Hello, everyone, and thank you for joining us for Arthritis Talks, Healthy Aging with Arthritis. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada. We've come together for this event from many different places, and I would just like to take a moment to acknowledge the land on which I am located on and on which our Toronto office stands, which is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabe, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis peoples, and I am so grateful to have the opportunity to live with my family and work on this land. Now, while arthritis can impact anyone at any age, aging with arthritis can be a unique journey with additional considerations to keep in mind. Tonight, we are so fortunate to be joined by Juanit Fazari, a physiotherapist from our Arthritis Rehabilitation and Education Program in Ontario, who will answer the most common questions we receive about arthritis and aging. Now, before we get started, a few logistics. First, this webinar is best viewed on a laptop or desktop computer. If you have technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A button at the bottom middle of the screen, not the chat, please. We will try to get to as many questions as possible during the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants as well as our chat moderator. Now, if you find that distracting and you'd like to close out of the chat completely, just click the red X icon to close out of the window. We are also pleased to continue to provide captioning of our webinars to accommodate the diverse needs of our audience. So you'll see that running along the bottom of the page. So many questions that we received in advance follow similar themes. So we will look at those first before we go into the live Q&A at the end of the session. And before we get started, I want to take a moment to thank our event partners, Pfizer, United Way Winnipeg, and others for their financial support of our Arthritis Talk series. Now, with that, let's get started. And first, a very warm welcome to today's expert, Joe Fazari. So before we get into some strategies around healthy aging and arthritis, Joe, could you just first describe what exactly healthy aging means?
Thanks, Sean, and welcome everyone. So healthy aging is not just aging in the absence of disease, but also in being able to function independently. So this may mean being able to do your activities of daily living, like getting dressed or eating with little or no assistance at all, but also being satisfied with your quality of life. So, this is being able to participate in all the things that are meaningful to you, like playing with your grandchildren. The diagram on the right side of the screen shows the biopsychosocial model, and this was developed in 1977 by George Engel. And what it details is all the factors that are important in our health that are important to consider as we age. Another thing to consider with healthy aging is self-management. So, what is self-management? It's really having the skills and the confidence to manage your arthritis on a day-to-day basis and its impact on your life and your emotions. So, if we think about how many hours there are in a year, you might get to spend maybe 12 hours of that time with a healthcare professional, but really we might be on our own for the bulk of that time. So feeling confident in your ability to manage your arthritis is important because it has been shown to decrease pain by 20% and decrease physician visits by 40% for chronic conditions.
Okay, that makes a lot of sense. Now, are there lifestyle adjustments that can be made to help slow down the aging process?
Yeah, so when we look at slowing down the aging process, it's also important to look at the risk factors that can be modified to decrease its impact on aging. So, what I mean is that these are the factors we can change to reduce your risk of developing or having worsening OA. And these factors are really important to especially address if you have multiple factors that you cannot change. So, excess weight, we know that obesity is a major risk for developing and progression of OA. It can affect osteoarthritis or OA through two mechanisms. So one is mechanical, meaning because of the excess weight, there's just more load that might be placed on your knee or your hip, which can hasten the breakdown of cartilage. The other is through inflammatory mediators. So we know that adipose or fat tissue has more pro-inflammatory enzymes present than muscle tissue does. Um, Inactivity, we know that physical activity is necessary for cartilage to regenerate properly. And I will talk a little more in detail about cartilage and how it's regenerated later on. But we just know that dynamic loading, like, for example, walking, is really necessary to feed our cartilage so that it maintains its health and also the bone health. And muscles, we know, are vital to absorbing shock, to stabilizing the joint. So poor muscle control and coordination can really result in improper loading of the joints and poor quality of movement. So that's why it is important to maintain our muscle strength also. Occupation, this can be debatable whether we can change it, but we know that certain occupations do have a higher risk when it is, let's say, a repetitive occupation. They have been shown to have higher prevalence of, let's say, hand osteoarthritis. And lastly, joint trauma and injury, which again, we can't always change if, let's say, you were in a car accident, but sometimes certain things like sport injuries, which can be prevented. So excess weight is a really difficult topic. Weight management is challenging for many people, and it's really not something that is can be applied on a large or a wide scale because it is very individual. But that being said, we know that healthy eating is really important. And what you see here before you is the Canada Food Guide. And really, it's generally recommended for most people. Of course, if you have other issues like maybe kidney disease, then it's important to discuss that with your dietitian. But generally, we recommend the Canada Food Guide. And as you can see here, half the plate is really full of colorful foods, your greens, your yellows, your orange fruits and vegetables, which are high in antioxidants. And the other half of the plate, we see a quarter of it is a plant-based protein food, which keeps us full and is important for muscle regeneration. And the last quarter is whole grain foods because we know that white refined flour is not great for us. And water, again, being the drink of choice. There's no real one specific diet that has been shown to be great for osteoarthritis, unfortunately. There's some evidence around a Mediterranean diet, which really encompasses most of these foods that we see here. So that's why we feel that a whole food diet is really the way to go to add to your quality of life as well. I know this is a very hot topic because we did get quite a few questions about vitamins and supplements and minerals. Well, unfortunately, I'm here to say that there's really no one magic supplement we know that's going to be great for your osteoarthritis. And a lot of the supplements that are out there right now, we can't widely recommend because there just isn't enough evidence to support their wide recommendation for people with osteoarthritis. That being said, we know that our body absorbs vitamins and minerals, and most dietitians would agree, it absorbs it best through our food. So that's why that whole food diet is really important because that's the best way. Eating a variety of foods is the best way to get that variety of vitamins and minerals that we need. So should you take a vitamin or a supplement for your arthritis? Well, the answer is that it depends. It depends on what exactly is you're deficient in, and it's a conversation really to be had with your doctor or your dietitian. Some parts of Canada, we don't get a lot of vitamin D, so that might be a supplement that your doctor might recommend you take. So really, as I said before, the best way to make sure that we're getting all of these vitamins into our body is really through a whole food diet. Now, this is an area near and dear to my heart, which is physical activity. We know that physical activity is great for so many host of issues that we can develop as we age, but arthritis being an important one because healthy cartilage really relies on physical activity. So if we think about our cartilage and you think of a sponge, that's really what your cartilage is like. So our cartilage actually doesn't have a lot of blood supply, and it relies on the fluid that surrounds it to get nutrition. So when your sponge or your cartilage is compressed, you can picture a sponge that you might squeeze in a bucket. It releases all the garbage, all the impurities that are in it into the fluid, which then is filtered out through our system. And then as that load is released and the sponge is released, it kind of sucks up all the good stuff, the good nutrients and the fluid that surround it. And that's really what the cartilage uses to regenerate or to rebuild itself. And how do we get that loading effect? Through activity. So we have two categories of activity we can think about. One is your daily activities. So all the chores that you have to get done around the house, your gardening, your raking, your shoveling. Um, I think of daily activities as important in the sense that you're not just sitting around. Therapeutic exercise, on the other hand, is a little bit different. It's goal oriented, it's a structured physical activity that includes awareness of your posture, your alignment. It's really done to improve your strength, your flexibility, your fitness, and your balance. So, some different categories there of therapeutic exercise, which I will expand on later. It's really important to include both in your day to get the full benefit of physical activity.
Thanks, Joe. Now, sometimes when people age, it can really bring a loss of independence. So, what are some things that people could do to really help maintain their independence as they age?
Yeah, so really to continue living independently with arthritis, it's important first to be aware of the symptoms of arthritis and then respond to manage them in a timely manner. So we can have physical symptoms like pain, stiffness, loss of range of motion, but we can also have functional symptoms like difficulty walking or going up the stairs, maybe putting on your shoes or your socks. And of course, your social and emotional impacts like feelings of isolation or being withdrawn from family and friends because you're fearful or unable to participate in activities. When we look at pain, it's a major physical symptoms that many people report with osteoarthritis. In order to manage pain adequately, which is important to do as we age, it's important to understand pain and why we might get it. So, this is a helpful diagram to kind of think about pain. And I like to think about our body's ability to manage pain like a bucket filling up with water. So the bucket, it represents your body and your ability or your experience with pain. Each of these factors could be a drop of water adding to your bucket. So on its own, you may be able to manage it, but if you're experiencing many of these factors at once, it may feel like your bucket is overflowing, and then you might end up in significant pain. So that's why the hope is really to reduce the size of each of these drops or eliminate them so that you can better manage your pain. And how do we do that? So there's many different methods, some of which we have already discussed, like your physical activity and your healthy eating strategies. But here are some other important concepts. So one is prioritizing, pacing, and planning. So I call them the three Ps. So Pacing really simply means taking breaks, not trying to get everything done in one day. If we can spread our tasks out over the course of a whole day or even, over a week, then it really helps prevent that prolonged amount of stress on the same joints. Another example of pacing is maybe splitting up your exercise into more manageable chunks throughout the day or throughout the week. Prioritizing is listing what is most important to you, and then to make sure that you have adequate pain control and adequate energy to do what you need to do uh, when you want to do it. You can also identify tasks that are important, too difficult, or too painful for you to complete so that you can hopefully pass them on to someone else if possible. The other method is changing our methods. So sometimes we get stuck in our ways of doing things a certain way, but it's important to kind of take a new look at how we're completing our tasks and see if there's a smarter way to complete some of those tasks. So this might mean that instead of lifting the heavy pot with your hands, you might instead slide the pot across the counter. Or if you're unable to stand for a long period of time, you might choose to sit down while you cut your vegetables and then stand up at the stove while you cook it. So those are just some examples, but taking a look at your day and seeing what are the things you do and how you can change them to better suit your body. Using devices, so gait aids can be really important in not just improving our balance, but also in decreasing your limping and really decreasing the amount of load that you're putting on your joints. A lot of people think of using a cane or a walker as taking a step backwards. They feel as though it's a sign that things are getting worse. But I kind of spin that on its head and say, well, when you're using a device, it can actually improve your physical activity. So it might be helpful to consider using a cane or a walker because it can actually help you become more active by improving your balance and your mobility. The last circle there is using a brace. So sometimes strengthening exercises can't tighten loose ligaments. And so we might need some external supports like braces or supportive footwear to help us get through that activity. Social and emotional well-being is also an important consideration because we know that nearly 1 in 5 Canadians 65 years and older say they lack companionship. Nearly 1/3 of older Canadians are at risk of being socially isolated. And we all know that the COVID pandemic has really fueled higher rates of social isolation and loneliness. So the result is, somewhat similar to smoking. They say smoking 15 cigarettes a day. So it's really important to consider your social and emotional well-being and stay connected with your community.
That's great, Joe. I'm really glad you're going to talk about this now because I've already seen this come up quite a bit in the questions. So we know that osteoarthritis and inflammatory types of arthritis are quite different. So question here around, are there different considerations related to aging for people with OA compared to those with inflammatory forms of arthritis?
Yes. So first and foremost, we know that people with inflammatory arthritis need to be on the proper medication to manage and control their immune system. So, following your rheumatologist's advice and guidance, and always reviewing any medication questions with them or your pharmacy team is really critical in managing inflammatory arthritis as you age. Also, for people with inflammatory arthritis, it's important to be aware of their zones of inflammation. So, what this means is if you think of a stoplight, you want to think of your inflammation similar to those lights. In the red zone, you might likely be in a flare up. So it's advisable to choose an exercise that alleviates stiff joints, sore muscles, like gentle range of motion or some isometric strength exercises. but really heavy resistance training and strengthening, and also sustained joint stretching should really be avoided at this time. You may decide to opt for some mindfulness or some breath work and postural exercises to prevent any muscle wasting or loss of aerobic fitness at that time. Next, if you're in the yellow zone, that means that you might have some joints that are active and you might have some mild inflammatory pain, but you're able to handle some low impact aerobic exercises and even some light isometric strengthening, for example. But you really want to progress anything you're doing very slowly, always waiting, the wait and see kind of method where you're waiting to see the response of that exercise on your body. And you may even want to start with something like body weight exercises or very light weights before progressing to higher loads. Finally, if you're in the green zone, that means that you might have no active joints and you're at low levels of pain. So you can continue to increase your tolerance to exercise, but it's still important to make sure that you're thinking of your fitness capacity and really progressing slowly and be mindful of your body's signals. Whether you have osteoarthritis, OA, or inflammatory arthritis, IA, everyone should consider these 4 main categories of exercise to include into their daily regime. So the first exercise is cardio, which is really what everyone thinks about when they think of exercise. And that's walking, biking, using the elliptical, for instance. It involves conditioning of your heart and your lungs. And it's really important for people with IA who are at greater risk of cardiovascular disease. Health Canada recommendations are the goal is to do about 150 minutes total of cardiovascular exercise per week. And you can really break that up into whatever chunks kind of suit your schedule. So some days you might be able to do a half an hour walk, whereas other days you may only be able to get out for 10 minutes, for instance. And perhaps walking is not accessible to you right now because of the weather, or if you have significant knee or hip pain, I would reconsider whether walking is the best exercise for someone to be doing. So that's why it's important to know that there's more options when it comes to exercise. Flexibility is another type of exercise, and this is stretching your muscles and moving your joints through a range of motion as comfortably as you can each day. So if we think about 2 different types of flexibility, we think about static, meaning stretching your muscles, and dynamic, which is improving your joint range of motion. And flexibility exercises are always more effective when your body's a bit warm. So it's good to consider maybe using a heating pad or having a hot shower, let's say, before you do these exercises. Balance exercises aim to reduce our risk of falls and improve our body's ability to stay upright. So our sense of balance, we know, can decline as we age, and it requires practice to help it improve and maintain. So balance is further improved when used in combination with strengthening, which we will elaborate on as well. And strengthening really is exercises that increase your muscles' ability to provide support and stability to a joint. So if your muscles are strong, then you require less energy and effort to accomplish your task, and you put less stress on the joint also.
Okay, great. So let's build on that. So we're hearing more and more about the importance of maintaining your strength as you age. So could you provide some tips for people about how can they help maintain their strength as they get older?
Yeah, I mean, exercise doesn't have to be complicated. It can be as simple as doing some heel raises while you brush your teeth, for example, or maybe doing a few squats, holding onto the kitchen counter while you wait for the kettle to boil. Really, these are just a few of the benefits of adding strength training to your day. But if you are new to strength training, then there are some things that you should consider. So if you are new to exercising in general and strength training, these are some general rules that I would recommend, but it's always advisable to check with your doctor or your physiotherapist first before you start any new exercise program. But generally, these tips are important to keep in mind. So one is listening to your body. To reduce discomfort while you're moving, it's first important to check your posture, check your alignment. It's important to wear good footwear, wear the appropriate clothes, make sure that you're hydrated before you start your exercise. Your body will send you messages if the movement doesn't feel right. And if you're not sure if what you're feeling is acceptable, then you should check with a therapist to make sure they can guide you along with how to do that exercise properly. Working within your comfort zone. So if you have arthritis, then you know, I don't need to tell you that different days demand different adjustments. So not every day will be the same. Some days you might have the energy to go and do your strength training program for a half an hour. Other days you may only be able to do some of your stretching exercises. So really pairing the activity with the demands are important because it'll help you stay within that comfortable zone. And also, it'll motivate you to keep going because no one wants to do exercises if they're not fun and if they're not comfortable. So, if we keep up a positive association with exercise, then it lets us, continue to build on our consistency with exercise. Going slowly is important. I always say it's okay if things feel easy on the first day. There's room to grow. Okay, so it's important to really master the alignment, the posture, the actual technique of the exercise, and making sure you're feeling it where you're supposed to be feeling it. So if you're doing a glute exercise, you're not feeling it in your calves, right? So it's important to go slow and to really give your body a chance to figure it out. Don't force it. So if your joints, let's say, don't have that range of motion available to them, either that day, or perhaps you have arthritis in that joint that your joints can't go into the full range of motion, then you don't want to force it. So if there's some swelling or some pain, you want to listen to your body and stay in your comfortable range of motion as well. The other thing I like to advise on is the two exercise rules. So rule number one is that some pain is okay and often expected when you're starting a new program. As long as it's not dramatically worsening during or after the exercise, then it's important to think of a few things. So one, where you are feeling the pain. So as I mentioned before, if you're doing a strengthening exercise, you should be feeling maybe some discomfort or soreness in your muscles and not in your joints. And the other thing is to think about how much that pain is increasing. So ideally, we don't want the pain to increase more than 2 points on your scale. So let's say when you start your exercise, you're at a 4 out of 10. By the end of the exercise or during the exercise, your pain should never really go up above a 6 or a 7 out of 10 at the most. If you find that the pain is quite severe after you do the exercise, then don't panic. You just have to make adjustments in the next session and change how you did it from how you did it the first time. Rule number 2 is that any increase in pain after exercise should go back to normal or the pre-exercise level within 24 hours or at the most 48 hours. If after you exercise, if you have so much pain that you can't walk for a week after, then that means you overdid it. So it's time to pull back, to adjust, to think about how many reps or sets or how much time you did it for, and make those adjustments the next time you do it. Some simple ideas to start resistance training if that's not a part of your routine right now. So, you can use some light equipment like dumbbells or resistance bands, which can be found pretty inexpensively. I've even seen them at the dollar store here. Some people even use water bottles that they can fill up with as much or as little water as they want so that it adjusts the amount of weight that they have. You can use heavier books if you'd like. So, really be creative with things you might have around the house to add some resistance. Or maybe you don't add any equipment and you use your body weight. So, you can see in the middle picture there, doing a squat using your own body weight can often be enough resistance for someone to start with. And lastly, I can't not talk about arthritis and exercise without mentioning water exercises. So a lot of people are always hesitant and they tell me, oh, but I don't know how to swim. And that's fair. But really, water exercises can be done even just walking in the water, because the buoyancy that the water provides, it improves your trunk stability. And for warm water, it can reduce pain, but water also has 12 times the resistance of air, so it helps strengthen your muscles. Neuromuscular strengthening is a form of strengthening that retrains the brain and the muscles to move correctly. And as the body starts to adapt to pain and weak muscles, our movement can start to change. So these types of exercises are important to improve the control of our movement. So moving in a proper way and using the right muscles. So no quote unquote cheating from our body to try to compensate or favor certain joints. And also, these exercises are performed with concentration, focusing on speed and control, for instance. The other target of these types of exercises is the quality of movement. So, making sure that our movement is done in proper alignment and posture through the entire exercise. There's really good evidence for neuromuscular strengthening, namely a program which is available in Canada called GLAD. And it is a research and evidence-based program that is found to benefit people with especially knee and hip osteoarthritis. So if you're curious to learn more about GLAD, I would encourage you to check out the GLAD Canada website and see if there's a program maybe available in your area. And I have to say that it's important to set goals when you're starting a strengthening program, any exercise program. Consistency is really the key to success. So setting goals to stay consistent is really important. That might look like having a journal or writing it down in your workbook. I have, a watch that tracks things as to how active I am throughout the day. And it also lets me see how active my friends are. So it might motivate me if my friend went for a walk or did her strength routine, then it might motivate me to do mine as well. So following up with, not just your friends, but also if you have a therapist that you see regularly to see how you are progressing. And it's important to reward yourself. And that might just look like taking a moment after you achieve the goal that you said you were going to achieve and giving yourself a pat on the back and acknowledging your hard work.
Thanks, Joe. Okay, switching gears a little bit. We know that falls can be pretty worrisome and frankly scary for older adults. So are there things that can be done to really prevent falls and help maintain balance as you get older?
Yeah, so strengthening is really important for balance. So that's the good news. If you're adding strengthening, you're kind of targeting you're targeting many different issues that might be at hand with arthritis. But balance exercises themselves are important as well, because it's important for your body to actually practice balance. So if standing on one foot seems a little daunting for you, and I do say that it's okay to be a little wobbly. I mean, that's the whole point. You're trying to train your body to not be wobbly. So it has to be wobbly to learn how not to be wobbly, if that makes sense. But of course, it has to be done safely as well. So if you live alone, it might not be a good idea for you to do that. Instead, balance exercises can be done with both feet, let's say in tandem standing. You might do it in the corner of a wall where two walls meet to have a little bit of added support. Um, Balance exercises can also be done in sitting. So that's the good news, is there's different variations depending on where you are with your balance. Other ideas are using Tai Chi and yoga, and many community centers and senior centers might offer classes to support you in your Tai Chi or yoga experience. And we do have lots of evidence to support them. So that's the good news. Footwear is also important for balance, so I won't go into too much detail here, but supportive shoes really help in optimizing the alignment of your foot and your ankle, as well as your knees, your hips, and your spine. It's most important to use supportive footwear when you're on your feet for a long period of time. So example, if you're walking to work, or if you're on a trip or on vacation and you're out on your feet all day. But you can always change out of them if you're sitting for most of the day. The two components that I really want to draw attention to here are the heel counter. So the firm heel counter, which is the support that you see around the heel of the shoe. It really helps improve your balance if you have that support. And the other one is the non-slip or the cushioned sole, which is really important. So even if maybe you're not a fan of wearing running shoes to a dinner party, then what you want to look for is uh, maybe a nice sandal that still has some of these features, like the heel support and a nice sole that is a non-slip sole. So something to keep in mind that maybe you haven't considered. And of course, your home safety and mobility is also important. We discussed canes and walkers earlier and how important they are for balance and gait, and also in improving your physical activity. But if you find that you're grabbing onto furniture, that might be an indication that you need a gait aid for balance. Other home environment considerations are, whether you have railings on both sides of your stairwell, or do you have any loose rugs that might be a tripping hazard? Do you have proper lighting, especially in your bedroom or your bathroom if you get up to use the bathroom at nighttime? And do you wear footwear indoors? Because that is important. Slip-on slippers aren't always, they can be a hazard. So a shoe or a sandal, as I mentioned, with a heel counter is advised.
So we talk a lot about the importance of having a healthcare team. So how can they help in terms of supporting you as you age?
Yeah, so having a good healthcare team of various disciplines is important to address different aspects of your health as you age. So, with your medications, it's important to have an open communication with your pharmacist and your doctor to make sure that you're reviewing your medications regularly, that you're taking your medications correctly and as advised. Alternative disciplines might be therapists that you see, such as massage therapists, osteopathy, acupuncturists. And I know there were a few questions about seeing alternative discipline practitioners that we received. Um, there's limited evidence for a lot of these strategies, but that only means that I can't recommend them widely. It doesn't mean that if it's working for you that I say no, it's because there's no evidence for it, you shouldn't do it. But it's important to consider the costs and the benefits, because a lot of these disciplines and therapies can be quite expensive. And so whether or not you're gaining the benefit from them that you want to gain is something that you should consider, and having the effect that you want it to have. We received a few questions about physiotherapy and hand and thumb osteoarthritis. and whether or not it can be effective. What I would say in this with this is that physiotherapists can assess your mobility and your strength of your hand and your thumb, maybe provide you with some specific advice around your day-to-day activities that you could change to help your arthritis. But a lot of the advice that you gain and the knowledge that you gain um, is what's most important, and maybe not the modalities like ultrasound that you might be getting, because we don't really have a lot of evidence to support those kinds of modalities like shock wave and laser. Again, if it's working for you, then that's great, but it's not something that we can widely recommend because we don't have evidence to say this works for everyone. Wellness strategies are, again, important to address for our mental health. So things like mindfulness, cognitive behavioral therapy, and looking at sleep strategies. It's important to manage your stress, which really helps you manage your pain. And for a few people, it's important to have that communication with their healthcare team, because we know that a small percentage of people, despite doing everything, at the bottom of the pyramid, a small percentage may need to see a specialized healthcare provider for osteoarthritis. We know that about 10 to 15% of people in Canada with osteoarthritis go on to need some joint replacement surgery. And again, non-surgical management is always considered first, but if it's not working and not adequately controlling your pain or enabling you to be adequately physically active, this is something that you need to communicate with your healthcare team, namely your family doctor or a specialist.
So Joe, before we get into the Q&A in a moment, do you have any final thoughts or recommendations for our viewers?
Yeah, so I would say, first of all, knowledge is power. So educate yourself on osteoarthritis, on all the self-management strategies, and our arthritis website, arthritis.ca, is a great resource. It has lots of um, great information about different types of arthritis, but also check out your local library, your local community centers or senior centers. Keep an eye out for health fairs, or they always have great sources of education or programs that you might not have been aware of that are offered in your community.
Amazing. Okay, so let's just get right in it, if that's okay. We have lots of good questions. I'm going to start with one that's come up a few times here, which is osteoarthritis reversible? So, for example, if you lose weight, can you reverse your OA?
Yeah, so unfortunately, we can't reverse OA. So once you have arthritis, you have it, it's in the joint, those changes are there. But the good news is that we can slow it down, and we can stop it from getting worse and worse and worse. And losing weight, for instance, or some of the strategies we talked about, are a great way to kind of slow it down.
That's great. And so sort of along those lines, and you talked a lot about cartilage. Can you rebuild cartilage? Are there supplements that you can take to increase it?
Yeah, so again, supplement wise, we don't have a lot of evidence to say that. I know glucosamine chondroitin is the one that comes up most for a lot of people. We don't have a lot of evidence to say that is going to help rebuild your cartilage. And just because something is natural, a natural supplement, doesn't always mean it's safe. So, for instance, with glucosamine chondroitin, it's in the name, glucose. So, if you have high blood sugar, then it might not be a good idea for you to put more glucose into your body. That being said, chondroitin has some limited evidence that it might be helpful, but it's really not strong evidence. So the best way to rebuild your cartilage is through, unfortunately, what I mentioned, fortunately or unfortunately, but effort, time, and exercise.
Okay. Building on that exercise comment, physical activity, you talked a lot about, people's pain and what they should do. A few people here are just asking, if you're in so much pain, just how do you start? Like, what's your best advice?
Yeah, so my best advice is not to look at what your neighbor is doing for exercise, but to always listen to your body. So that might mean that maybe you start your exercises in a lying down position so that there's not a lot of force on your joints when you're doing your exercises, or maybe in a sitting position. The other example that I mentioned is water. So maybe you don't join a aquafit class, but you just go in the water, you sit and you do a few movements, because we know that water can help reduce that stress on the joints. So what I would say is, if you're really lost, then reach out to a physiotherapist in your community that you trust and that might have some experience around treating osteoarthritis, because really there is somewhere for everyone to start. It's just a matter of finding the right exercise for you.
Right. You talked about footwear for people with arthritis. A specific question here about is there any good footwear to wear in pools when you're doing that physical activity in water?
Yeah, so I do recommend that people wear some water shoes. If you've seen them, they usually have a rubber sole on the bottom of them. And there's many brands, so I can't, promote one brand over the other. I'm not sponsored by any of them. But what I would say is something affordable that allows you to slip them on, and something that has a non-slip bottom could be a great option to wear in the pool.
Okay. You had a lot of great information about diet. You mentioned following a whole food diet a few times. Could you just elaborate on what exactly that means, that whole food diet?
Yeah, so what I mean by whole foods is really looking at all the categories of foods there are. And we know the big one is really vegetables and fruits, and protein being another category, and lastly, grains being a category. And of course, we have, our indulgences as well, that I'm not saying we should completely cut out. I think we would be inhuman if someone was completely able to cut those out, but that is another category as well. So when we think about whole foods, we're thinking about including at least out of the first three categories the most we can. And when we think about that Canada Food Guide, we want to think about having foods that are um, not processed. So the way I picture is not coming out of a box. And so most of our diet is filled with food like fruits and vegetables that grow on plants, right? So keeping half of your plate really full of those types of foods, fruits, vegetables, and then the other half looking at things like protein and grain. So encompassing really all the categories of foods.
Okay, great. You talked a little bit about the Mediterranean diet. Anything you can say about, for example, a gluten-free diet and whether there are any benefits there to discuss?
So there is some limited evidence that a gluten-free diet may be helpful for people with rheumatoid arthritis, but it is very limited evidence. So I don't like to deny people their gluten if it's meaningful to them. But that being said, everyone's body is unique to them. So if you feel that when you eat gluten, you have certain signs that show those sensitivities of gluten, then it might be something for you to consider to eliminate that. But it's not something that I would tell everyone to do, because there may be people who don't have any sensitivities to gluten and don't have any problems with digesting it. So again, it's something that is important to discuss with your doctor or your dietitian. If you feel like there might be a sensitivity to gluten, then something to consider eliminating, but to discuss with your healthcare team first.
Okay. We have a few questions here around assistive devices. The
Mhm.
first one here is someone explaining that they've heard that, sometimes if you use something like a walker or some other support, it can actually be harmful because it changes your gait and your posture. Is there any evidence to support that?
Not that I know of. In fact, I would say it's the opposite. If the walker and cane are used correctly, so they do have to be adjusted to the correct height first of all. And if you are using it in a way that it's not meant to be used, then sure, it could lend to further issues. And there are often times where people have come in to see me for an appointment and have their cane in tow. And, I've had to adjust the height of the cane, for instance, so that it doesn't bother their shoulder. And so I would say that when you're using assistive devices, that it is important to have it correctly suited to your body and to know that you're using it appropriately. But once you have all those things ticked off, then it should actually help improve your gait and should feel quite natural when you're using it.
Okay. What about walking poles? I don't think you touched on them, but some
No.
questions about whether they would be a benefit to people.
Yeah, I do. I do think walking poles are a great option. Especially, I understand that, people are often hesitant to use a cane because they don't want to look old. And so I can understand that that's a concern. So I like walking poles as a alternative because it will still provide some of those benefits that a cane and a walker might provide. I like that it's symmetrical, so you can have one in each hand. And again, it can be adjusted to your height so that it suits your body appropriately. And also, it can unload your joints by placing some of that load onto the walking pole and improve your balance. There are some brands of walking poles that are designed specifically for people with osteoarthritis called activator poles. They're usually a little more expensive, but we recommend them because the bottom of the poles are a flat top, similar to what you might see in a cane, which makes it a little bit easier and provides less resistance when you're using them. So, yeah, thanks. That's a good question.
Okay. Um, as you mentioned earlier, we did receive a number of questions about arthritis in the hands. So the question is, can and how would a physiotherapist help somebody with arthritis in their hands?
Yes, so I would say that, one, it depends on the experience of the physiotherapist. So if they have a lot of experience in treating hands, then they can likely give you some good advice around even assistive devices for the hands, for instance. So for example, something that I mentioned to people is thinking about changing your method. So instead of lifting things with one hand, using both hands, for instance, or using assistive devices like a food processor to take away some of that manual chopping that you might do with a knife using your hands and involving a lot of gripping and strength. So, an experienced physiotherapist who has some advice to give you to alter some of these strategies that you may do day to day could alleviate a lot of those symptoms or that pain that you're feeling. And also, they could offer you some appropriate exercises to do. What usually happens with hands is that we tend to put more loading on the joints of our hands and not use the small muscles in our hands adequately. So, some of the exercises can help to improve the muscle engagement of our hand muscles. And so, a good physiotherapist would be able to give you those appropriate exercises for you to do. And like I said, physiotherapy is more about those education, exercise, and maybe providing with some pain management modalities. But whether or not those modalities are suitable for you, like whether or not they work for you, is hard to say because we don't have a lot of evidence to say that those modalities are always 100% effective.
Okay, that's great. Um, Speaking of pain, a few people are asking, would it be advisable to take pain medications before trying to exercise? Is that something that you would advise people to consider?
So I can advise on medication since I'm a physiotherapist, but what I would say is important to talk to your doctor, one, if it's safe for you to take pain medication, And two is sometimes it can be helpful to take medications before exercise if you do find it difficult to do exercise otherwise. But using that caution of the 2 point rule, where you're you want to be cautious of not pushing yourself too hard if you can't feel the response of your body, since it would be dampened because of the pain medication. There might be potential for you to push a little too hard, and then it would be the next day that you might feel the consequences of that work that you do. So yes, if you think that taking pain medication might make it more comfortable for you to exercise, then that's something to discuss with your doctor and could be a possible strategy. But you still want to be careful about how much you push yourself during that exercise. Even if you can't feel pain, you want to make sure that you start off easy, start off slow, and progress slowly.
Okay. I think this is a great question. The question here is osteoarthritis only age-related?
So, no, osteoarthritis is not only age related. We know that age is a factor, a risk factor in developing osteoarthritis, and it's a factor that we can't change. But a story that I like to tell people is, Mr. Smith goes to the doctor and says he has pain in his right knee. And the doctor looks at his right knee and says, "Oh, Mr. Smith, you're getting old. Your right knee has arthritis in it." And Mr. Smith responds, "Well, my left knee is the same age and has no issues," right? So we know that age is not always related to osteoarthritis. We know that young people can develop it as well. We don't really know the exact causes of osteoarthritis. We just know that there are certain factors that might increase your risk of getting it.
That's great. I think we have time for one more question. We have a few people who are experiencing life after hip replacement or knee replacement. So they've asked questions like, are there recommendations that you've talked about this evening related to exercise, diet, etc.? Could these actually help maximize success for a joint replacement?
Yes, so with joint replacements, first of all, pre-joint replacement, we know that people who have a good pre-op function in terms of strength and mobility are going to have positive outcomes coming out of the surgery, higher chance of positive outcomes. So after joint surgery, yes, it is important to consider a lot of these factors. Of course, with surgeries, there are some rules that we have to follow as far as surgical rules that we have to stick to as far as timelines go. And so that's important to keep in mind when progressing your exercises. And having the guidance of a therapist is helpful to know when you can progress those exercises. But certainly, let's say, making sure that you're following your Health Canada recommendations for food and the amount of physical activity you're getting, it can be important for people after surgery as well.
That's great, Joe. So thank you again so much for sharing all of your knowledge with us today. We would like to take just a few moments to get the audience's feedback on today's presentation. So for those of you who are watching on Zoom, you should see a poll question pop up on your screen with a few answer options. And obviously click on the response that reflects your thoughts. And the question is, I feel more knowledgeable and empowered after attending this webinar. Tell us how you feel, please. We will also be sending you an evaluation form when we email the recording and the slides. So if you weren't able to access that poll question, you will have the opportunity to give us feedback at that time. And we always use the survey feedback to shape our future Arthritis Talks webinars. And so we truly value your input. So if you have a moment, we'd be very grateful. And once again, we are grateful to Pfizer, United Way Winnipeg, and our others for their financial support of this event. We will be back on February 21st for an Arthritis Talks focused on osteoarthritis. More information and the link to register will be included in an email to you tomorrow. So with that, this concludes tonight's Arthritis Talks. On behalf of all of us, thank you so much for joining us today, and please stay well.